there's a long history of abysmal waiting lists and agonising waiting time for children with spina bifida and scoliosis. And it's been a recurring issue for years, which government after government have failed to address time after time. In 2017, the then Minister for Health, Simon Harris, set a target for a minimum wait time of 4 months for surgery. That was never met. As of June this year, 287 children are on a waiting list for spinal surgery. 120 of these children have been waiting over a year. And during this time, the government ceased a treatment abroad option, which helped more than 30 children get access to care. That information alone is in itself shocking. However, to find out, primarily through the reporting of the Ditch, that allegations have arisen that in a number of spina bifida-related surgeries carried out at Temple Street Children's Hospital, unlicensed implants made with non-medical parts were implanted in children. It's alleged that springs which were not meant for surgical use were purchased and subsequently used on at least 3 young patients. And in 2 cases, these springs had to be removed after causing significant harm to the patients. Patient safety concerns about the number of repeat operations required on young spina bifida patients and associated rates of reinfection were raised from July of 2022. It eventually resulted in certain surgeries being suspended at Temple Street in November of 2022, and Children's Health Ireland commissioning an internal and external review. The HSE were advised by CHI that a number of reviews relating to patient safety concerns within the CHI paediatric orthopedic surgery service were being undertaken, and in August this year the report was provided to the HSE. But advocates and families relay that they have, however, still not seen the full external report, which is only being published in abbreviated form. In July this year, the HSE took the decision to commission an independent overarching external review by an international clinical expert. However, advocates and families have reported that they are excluded from devising the terms of reference of this review. They use the analogy of the review being like a bus journey, where the HSE are in the driving seat dictating the destination while they are told to sit back and stay silent. The hands-off approach taken by the Minister has made the situation for these families worse by failing to include them, and has led to families and their advocates stating that they do not have confidence in the HSE's review. It's simply disgraced that children and their families have not been put first throughout this scandal. They are at the centre of this, and they should be central to the government and the HSE's response. Their voices must be heard and their input must be taken on board. And I am glad that you are meeting with them and that the lead of the review will be meeting with them. But, as I said, their input has to be taken on board. It can't be just a box-ticking exercise. The full review, the report and all reviews must be published in full to provide full clarity and transparency for families. And the terms of reference for the independent review must address all of the concerns of the families and advocacy groups, including the years-long failure to address agonising waiting lists. The current review cannot just simply focus on the actions of one doctor. There needs to be an investigation regarding clinical governance, not only at Temple Street, but across all hospitals under Children's Health Ireland that have been carrying out these procedures. It is highly concerning that a consultant managed to purchase and use these devices in the first place. It is equally concerning that CHI and the HSE kept this under wraps. The length of time it took to disclose these offences to families and children under the care of this consultant is completely unacceptable. And the review must be widened so that we can get to the bottom of what happened, how it was allowed to happen, and what must be done to ensure it doesn't happen again. And there are still many outstanding issues and questions that must be addressed. Now, why weren't families immediately involved in engagement and transparency as soon as you became aware, Minister, of the allegations? Why weren't they made aware exactly of what was happening? Why were they not included in drafting the terms of reference of the current review? If they're going to be included now, it has to be wholesome. The first external review has not been shared or published. It should be immediately. Now, perhaps you have to clarify that it has, but all reviews need to be. I'm just wondering, when did the CHI learn of these experimental surgeries? When did staff first raise concerns? There needs to be processes put in place around the procurement of devices and arrangements put in place to ensure proper clinical governance. I don't know how this fell between the gaps for so long that it happened that the unauthorised devices were actually used in operations. I suppose a question as well, why when the first adverse incident occurred in July of 2022, it took until November to commission an investigation. So it's vitally important to remember that whilst this is proceeding, it is imperative that the government act to ensure that the children waiting on surgeries are not forced to wait even longer. Thank you.